The Ora-Light Oral Motor Exercise System is an exciting new therapy tool that targets and maximizes rehabilitation outcomes for patients with oral motor deficits. The Ora-Light Oral Motor Exercise System is ideal for patients with weak or dysfunctional oral muscles that limit their ability to effectively speak, swallow, or chew. The goal of the Ora-Light Oral Motor Exercise System is to strengthen the musculature of the tongue, lips, and cheeks, and facilitate neuromuscular coordination and competency for speech and swallowing. The Ora-Light Oral Motor Exercise tools have activating shapes and textures to provide increased sensory feedback. This sensory feedback contributes to the initiation and timing of patterned oral motor activity. The Ora-Light Oral Motor Exercise System can be utilized in both a clinical therapy session and in a patient's home. Exercise therapy in a patient's home can cut costs and save time for both the patient and the therapist. The additional repetitions of correct muscle movement patterns will expedite improvements in the patient's speech and swallowing. The goal is to provide as much repetition of the correct muscle movement pattern as possible to achieve automatic execution of the skilled task. An educational exercise protocol is used with each of the 4 exercise tools. This enables the patient to carry out consistent and repetitive exercises to strengthen the muscles of the lips, cheeks, tongue, and to facilitate neuromuscular competence. A baseline and suggested training exercise protocols are illustrated in the instruction manual. The purpose of this program is to feature baseline exercise protocols for each of the Ora-Light tools. The baseline exercise protocol for the child-size Ora-Light Oral Motor Exercise System are identical to the ones featured in this program. The Ora-Light Oral Motor Exercise System can be utilized in children's therapy for functional articulation disorders, swallowing, and tongue thrusting therapy. The exercise protocol consists of 5 parts. 1. Assisted movement exercise. 2. Isometric exercise. 3. Isotonic strengthening exercise. 4. Precision and accuracy of articulated sounds and neuromuscular control exercise. 5. Swallowing exercise. The baseline exercise protocols enable therapists to establish a level of muscle strength and endurance at the start of training. The baseline exercise protocols also allow the therapist to measure progress during and at the conclusion of therapy. Patients who experience this therapy become highly motivated to succeed in rehabilitations as a result of positive feedback that is provided by improvement in functional competence. Tool number 1 has 2 functions. One is to strengthen the lip and cheek muscles. The second function is to retrain tongue thrusting. Tool number 1 will help guide patients to position their tongue tip on the palate behind the front teeth, instead of thrusting their tongue between the lips and out of the mouth. Tool number 1 has a football shape on the handle with a textured surface. Also note the hole opening on tool number 1. This helps the patient feel where the tongue tip should be placed, guiding the patient to position the tongue tip on the palate behind the front teeth when speaking and swallowing. Muscles exercised include orbicularis oris, mentalis, levator labii superioris, and buccinator. The goal of exercise protocol 1 is to strengthen lip closure. Place tool number 1 on the palate behind the front teeth. The therapist will assist the patient to close lips around the football shape, using thumb and finger to assist the movement. This allows the patient to get a tactile feel of lips against the football shape. The goal of exercise protocol 2 is lip strengthening. Place tool number 1 on the palate behind the front teeth. Elevate the tongue tip in the hole opening. Close lips around the football shape. Maintain tongue tip elevation until the patient experiences fatigue. Record time of tongue tip elevation in the number of seconds. The goal of exercise protocol 3 is to increase range and ease of movement. Place tool number 1 on the palate behind the front teeth. Open and close the lips around the football shape as many times as possible. Record number of closures until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 1 on the palate behind the front teeth. Repeat the following sounds with the lips closing around the football shape every time a P sound is made. Repeat sounds.
Pa, pa, pe, poo, ape, ip, oot.
Repeat sounds. Pa pa, pa pa. Record the number of pa pa sounds articulated in 10 seconds.
Pa 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 pa.
The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 1 on the palate behind the front teeth. Place tongue tip in the hole opening. Bite teeth on the handle, swallow with lips against the football shape. Tool number 2 is designed to strengthen the tongue tip elevation movement to the palate. Tool number 2 is also used to retrain tongue thrusters to reposition the tongue tip inside the mouth on the palate behind the front teeth. Note the hole opening in tool number 2. This helps the patient feel where the tongue tip should be placed, guiding the patient to position the tongue tip on the palate behind the front teeth when speaking and swallowing. Muscles exercised include the genioglossus and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the tongue tip inserted into the hole opening of tool number 2. Place tool number 2 in the palate. Position the tongue tip into the hole opening. This allows the patient to get a tactile feel of contact against the hole opening. The goal of exercise protocol 2 is tongue tip elevation strengthening. Place tool number 2 on the palate behind the front teeth. Press the tip of the tongue into the hole opening. Apply pressure as long as possible. Record number of seconds that pressure can be maintained. The goal of exercise protocol 3 is to increase range and ease of movement of tongue tip elevation to a front palatal position. Place tool number 2 on the palate behind the front teeth. Elevate and lower the tongue tip in the hole opening. Repeat as many times as possible. Record the number of tongue tip elevations into the hole opening until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 2 on the palate behind the front teeth. Elevate the tongue tip in the hole opening and repeat the following sounds.
Ta, ta, eight, oot, eat.
Repeat sounds. Pa-ta, pa-ta. Record the number of pa-ta sounds articulated in 10 seconds. The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 2 on the palate behind the front teeth. Elevate the tongue tip into the hole opening. Bite teeth on the handle. Swallow. Tool number 3 is designed to strengthen the tongue tip and retrain tongue thrusters to use corrected patterns with repetition to achieve automatic execution of proper tongue tip positioning. Patients are encouraged to use both tool number 2 and 3 in tandem, using the exercise protocols as a tongue tip exercise. Tool number 3 features a concave section that pushes up to form a ridge, which is textured. Exercising the tongue tip against this ridge both strengthens the tongue tip and reminds the patient not to thrust their tongue by restraining forward tongue movement. Muscles exercised include genioglossus and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the tongue tip against the ridge of tool number 3 that shields the tongue from thrusting. The patient will press the tip of the tongue against the concave section of the ridge. Close the lips, and the patient should get the tactile sensation of an intraoral position while restraining the tongue from pushing or thrusting out of the mouth. The goal of exercise protocol 2 is strengthening. Place tool number 3 on the palate behind the front teeth. Elevate the tongue tip against the concave section of the ridge. Maintain pressure against the ridge until fatigue. Record patient's ability to apply tongue tip pressure until fatigue in number of seconds. The goal of exercise protocol 3 is range and ease of motion. Place tool number 3 on the palate behind the front teeth. Elevate tongue tip against the concave section of the ridge. Lower the tongue tip from the concave section of the ridge. Continue to elevate and lower the tongue tip until the patient experiences fatigue. Record number of elevations within a 10-second period. The goal of exercise protocol 4 is precision of movement. Place tool number 3 on the palate behind the front teeth. Repeat the following sounds.
Ka, ta, eat, oot, eat.
Repeat the combination of sounds. Pata, pata. Record the number of pata sounds articulated in 10 seconds. The goal of Protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 3 on the palate behind the front teeth. Bite teeth on the handle, close lips, and swallow. Tool number 4 is designed to strengthen the back elevation of the tongue for speech and swallowing. Weak tongue elevation movement that cannot contact the back of the palate during swallowing may lead to aspiration of food into the lungs and possible pneumonia. Tool number 4 has an elevated ridge with a textured surface. The combination of these features help the tongue feel the proper placement in the back of the palate. Muscles exercised include genioglossus, styloglossus, palatoglossus, hyoglossus, and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the ridge of tool number 4 against the back of the tongue. Place the ridge of tool number 4 on the back of the tongue to give the patient a tactile sensation of where the tongue should elevate, to the back of the palate. The goal of exercise protocol 2 is strengthening. Place tool number 4 on the palate behind the front teeth. Elevate the back of the tongue against tool number 4. Maintain elevation as long as possible. Record time of elevation in number of seconds. The goal of exercise protocol 3 is to increase range and ease of motion for the back of the tongue to extend to the back of the hard palate. Place tool number 4 on the palate behind the front teeth. Elevate and lower the back of the tongue against the ridge of tool number 4. Repeat as many times as possible. Record number of elevations until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 4 on the palate behind the front teeth. Make sure that the back of the tongue makes contact with the ridge as the patient repeats the following sounds.
Ka, ka, ache, ook, eek.
Repeat the combination of sounds. Pa, ta, ka, pataka. Record the number of combinations articulated in 10 seconds. The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 4 on the palate behind the front teeth. Bite teeth on the handle, close lips, and swallow. For the complete set of exercise protocols using the Ora-Light Oral Motor Exercise System, refer to the instruction manual included with your Ora-Light package. Patients can achieve positive results in a shorter time period by utilizing the Ora-Light Motor Exercise System in both a clinical therapy environment and with repetitive oral motor exercise in a patient's home. The additional repetitions of correct muscle movement patterns will expedite improvements in the patient's speech and swallowing. The goal of the Ora-Light Oral Motor Exercise System is to provide as much repetition of the corrected pattern as possible and to achieve automatic execution of the skilled task. For additional information on the Ora-Light system, go online to capitex.com or contact your local sales representative.